Kurt, can a cloud infrastructure safely be used to process protected health information while also, being available and able to do processes that the way the healthcare industry needs them to do?
Yeah, and I think there's some misconceptions about security in the cloud. You can find providers who provide adequate and good security that helps you mitigate the risks typically found from internet-based sort of transaction processing. It is interesting that in a lot of cases there's a trade-off between, or a perceived trade-off between security and performance, but that doesn't necessarily have to be the case. If you find a provider who's integrated security into their infrastructure and built it on top of a high-performance platform, that oftentimes takes care of a lot of the issues around that. So you can have a highly available, high-performing cloud infrastructure that still provides the kind of security that you need in order to process PHI.
Okay. Now there's a lot of hype around HIPAA right now. What can providers do to ensure that their cloud provider is doing their due diligence in the security and privacy arena with their product?
Yeah, there is a lot of hype. There's a lot of companies and service providers making what I'll call outrageous marketing claims. 100% HIPAA compliance, leave the HIPAA compliance to us, store your data with us and you don't have to worry about HIPAA. And none of those are really true. And I think in order to cut through the hype, the healthcare organizations need to ask very pointed questions, and they need to ask specifically what security services is the provider offering? How do those services directly benefit the customer? Because it's one thing for a provider to say, we're HIPAA compliant, and we all know since there's no certification program, anybody can say they're HIPAA compliant. Well, it's great if the cloud provider is saying they're HIPAA compliant, but how does that actually help the healthcare organization? So they need to ask specifically, what are they offering? How do those offerings actually help them as a healthcare organization meet their HIPAA compliance obligations, or assist them in meeting their HIPAA compliance obligations? And then ask for some sort of proof to back these claims up. I mean, do they have any third-party audits? Have they got any, are they willing to provide any details around their security program or any sort of third-party attestations? Mm-hmm. So it's really about being a smarter cloud consumer. You have to ask the right questions and really try to dig in, and don't just believe the marketing hype.
Now, when a healthcare provider, when they end their relationship with a cloud provider, how do they ensure that they're with a provider who will safely either destroy the information, or if that's not possible, just make sure that it's safeguarded, the protected health information?
So we get that question quite a lot, and built into our process, and any time when you're in a cloud environment, when you deprovision or say we want to cancel the services, typically the cloud provider just disintegrates that construct of resources that have known as that have been put together to form that cloud server. In our case, we provide documentation about how that's done, and it is secure, and we actually provide a certificate of destruction. But you need to ask the question, because some may or may not take as much care in doing that, and again, if they're not going to be able to contractually, you could have an agreement. We've had some providers ask for us to keep their data for 6 years after the end of the relationship. And we say, well, that's really not feasible in our model. If you need to keep that data, then you need to take a copy of it before you end the relationship, and then we'll securely delete it, provide you with a certificate of destruction, and allow you to move on.
Great. Well, Kurt, thank you very much for speaking with me today. We appreciate it.
Thank you.